Look.
Right. Let's wait a couple of minutes while all attendees get connected. We have some participants coming up. All right. All right. So, good evening. My name is Angela Ventura. I'm a prevention specialist at United Way of Broward County Commission on Behavioral Health and Drug Prevention. First of all, thank you to all of you for joining us today. Thank you to United Way of Broward County Commission on Behavioral Health and Drug Prevention, and to BBHC, Broward Behavioral Health Coalition. And a very special thank you to our community response team, and more specifically to its policy work group, for organizing, planning, and making this event possible. Beyond the pandemic emergency, there are many crises happening. The opioid epidemic, Florida reported 5,621 overdose deaths, a 14% increase from January 2019 to January 2020, according to the CDC. And in parts of South Florida, early numbers suggest 2020 could be even worse. We are also facing a mental health crisis. Data from the National Survey on Drug Use and Health shows that adolescents have significantly increased rates for major depressive episode and substance use. Also, significant increases in mental health disorders and substance use disorders are observed in adults ages 18 to 49. And how about the suicide crisis? According to the CDC, men represent 79% of all US suicides. Suicide among men is 4 times higher than suicide among women. We are also hearing about evictions, unemployment, isolation, jobs are disappearing, and many people are ending up homeless, uninsured, and without food on their tables. And we know that food insecurity manifests itself in diabetes, high blood pressure, obesity, etc. And all these are high risk factors for COVID-19. And on top of that, public health actions such as social distancing can make people feel isolated, lonely, and this can increase the levels of stress and anxiety. However, they are necessary to reduce the spread of COVID-19. How can we circumvent this? Well, we are so blessed to live in a community that has many resources, people, and organizations that are working hard every day, providing support, filling gaps, making needs assessments, and producing information for action. Organizations like United Way, Broward Behavioral Health Coalition, 211, etc., are there to help the community and support the efforts. So without any more delay, let's welcome the moderator of today's event. She is one of our very own from United Way of Broward County and is the Director of Public Policy and Strategic Initiatives. Please welcome Ms. Heather Davidson.
Thank you, Angela. Hi, good evening. We are so excited to see you all here this evening. Even though we can't see you, I can see your numbers popping up on our participant screen. We had over 250 people register for this event this evening, and it really just goes to show that this conversation is so sorely needed. Our community is facing uncertainty. Our nation is facing uncertainty due to COVID-19 and its impacts on our unemployment, on its impacts on our finances, our food security, our mental health, our stability, and our ability to connect with other people. The format of this event is just an example of how we're having to connect with each other now. And we wanted to bring our esteemed speakers and panelists here this evening to have the opportunity to connect with you, our community stakeholders, to be able to ask questions, discuss some of your major concerns that you have regarding what's happening in our community, some lessons learned from COVID-19, maybe gaps that we've seen within our own systems of care, and how we move forward together as a community. How this is going to work, housekeeping wise, you have a Q&A box. If you put your questions, any questions you want, you can direct them to our panelists, or you can have it open-ended and we will field that out. I will ask the questions to our panelists and we will make this a discussion and see if we can get some of your questions answered regarding COVID-19 in our community. So you know who you've got with you this evening, although they probably need no introduction. We have the Honorable Judge Ginger Lerner-Wren from the 17th Circuit Court. Judge Wren, if you could please introduce yourself briefly.
Thank you so much, Heather. And first of all, what a privilege it is to be here, and to all of our viewers. Really, I'm so honored to join what I know is really going to be the very first, dialogue and community meeting that we have to talk about all these important issues at this very serious time. You know, I preside over what is our nation's very first problem-solving mental health court in the United States. And you know, one thing and one very important lesson that I want to share right at the beginning is what we can do when we all come together as a community in collaboration to solve problems together. That is what I think, takes, crisis and really turns it into opportunity, to revision how systems and resources can work to really transcend these times. So thank you so much for having me, and also to be part of our Board of Governors of the United Way.
Thank you, Judge Wren. And we also have Garry Smyth, the Chief Operating Officer for Fifth Street Counseling.
Thanks, Heather, and thank you, Judge Wren. That was a beautiful introduction. And Angela, you did a great job setting us up. And Representative Gottlieb, I know you're extraordinarily busy, so thank you very much for taking the time tonight to be able to join us. Like Heather said, my name is Garry Smyth. I am the Chief Operating Officer of Fifth Street Counseling, which is a Medicaid community mental health center, which has served Broward County since 1991. And amongst other boards, my most proud accomplishment each month is attending the United Way of Broward Board of Governors, where I am the second vice chair, along with Judge Lerner-Wren.
Thank you so much, Garry. We're so happy to have you. And of course, we have Florida House Representative Michael Gottlieb with us this evening. Thank you so much for your time. If you could please introduce yourself, tell us a little bit about you.
I will, Heather, and thank you and Angela and the United Way for having me. And I do feel, as Judge Wren said, privileged to be here. I think that we all bring a unique perspective, not just from our daily lives, but from what we do for a living. In addition to being a recent representative in the Florida State House, I'm also a criminal defense practitioner. I've been practicing in Broward County for 28 years. So I'm seeing this pandemic as a father, as a husband, as a criminal defense lawyer, as a state rep, so many different facets, as I'm sure everybody else is, especially Judge Wren still holding court. We're seeing you people, our constituents, and we're here tonight to lend a hand and to help you. And to that extent, we welcome your questions. We're really happy to be here, and we hope that this is a successful event. We know it will be, so that we'll hopefully see you all in the future.
Absolutely. Thank you so much. Our panelists are all extremely talented, knowledgeable individuals who their time is very precious. So we are extremely lucky to have you all here to answer questions. And with that, we're going to go ahead and open it up and get started. I do have a question starting out for you, Representative Gottlieb. Not to
Okay.
put you on the spot, but we're going to get started with you. So we're seeing a lot of conversation on the state level about budget shortfalls coming up for our session, which will start in 2021. And we are wondering, what will we see are the funding priorities for the state of Florida coming up in this next year?
So that's a wonderful question, Heather. And it's a question that really doesn't have an answer yet. So I don't want anybody to think I'm dodging it, but the Florida legislature, number one, we don't have our full makeup until the November elections end. So we don't know who our body exactly is going to be. Number two, we know that there is going to be a budget shortfall of at least $1 to $2 billion moving into the next session. Now that sounds like a tremendous amount of money. And of course it is to any individual, but to the state's budget of approximately $93 billion, it doesn't necessarily harm us. Number three, because we have $5 billion in reserves. So we have some money. Hopefully we don't have to use that reserve money. We do know that there's a hurricane right now that is hitting the Panhandle. Hopefully it's not terribly devastating. We know that there will obviously be some money that has to be spent there. But if we can reach into our reserves and deal with the shortfall that we have from number one, our DEO issues and our tourism issues, I think we'll be okay. Clearly, we're going to need to focus on people's mental health. Alcoholism is through the roof. I think alcohol sales are up 400%. And when the pandemic's over, people are going to have acute traumatic stress, post-traumatic stress, anxiety, depression. So there's a lot that we need to focus on as a legislature. Where that money's going to go, I don't know, but I do know that we're all here for anybody who needs assistance. And of course, we're going to try to prioritize mental health as something we should be spending on moving forward.
Absolutely. I think that's a great point that we've seen a lot of issues come to light with increased overdoses, as Angela mentioned in her opening. We're seeing increased sales for alcohol, and we're seeing to even our own 211 line locally in Broward County. We've seen an increase in calls for both mental health assistance and for suicide crisis that we just have never seen before historically. And with that, I want to ask Garry, coming from a treatment perspective, have you seen, number one, how have you seen your clients be engaged during COVID-19 who have co-occurring disorders, meaning they have a substance use disorder and a mental health diagnosis? Are they remaining engaged in their services as they've switched to telehealth, and what does that look like?
So that's a good question, Heather. And a lot of people, I think, who have not experienced online telehealth or teletherapy are going to be naturally scared of it. The good news is that an overwhelming majority of our clients and other practices around the state that I've engaged with have reported that the clients are adapting very quickly and very easily to telehealth. And in many cases, we serve an at-risk population where oftentimes being able to take care of your responsibilities as it relates to your mental health are encumbered by childcare or transportation issues. Really basic for some of us, but for others in the vulnerable part of our population, those are big challenges, and telehealth is extraordinarily convenient for them and allows them to be engaged. Also, the state has waived the copays for clients to attend telehealth, so that's also been a very big incentive for people to reach out. And as you mentioned, there are lots of people in need. Our current engagement rate is up almost 100% over the same time last year, and there doesn't seem to be an end in sight. So there's lots of people out there that need help.
That's fantastic. And there's a huge need. And from our providers in the community, we have heard that just within our own, outside of the data, we're hearing, the barefoot epidemiology, that a lot of folks are not engaged with their services, or we're having these higher rates of relapses as people maybe don't feel as comfortable with telehealth or maybe don't feel safe coming in. For those providers, and even those—
I don't know that it's that, Heather, as much as one of the characteristics of someone who is in the throes of a substance use disorder is isolation.
That's
so
fair.
This is an extraordinarily easy time to isolate and to not be called out for drinking too much or misusing your prescription pills. This is a much easier time for people to, keep others away if that's what, their addiction is telling them to do.
That's an excellent point. And to that, for our providers or to our folks who may be struggling, I mean, what would you say to keep folks engaged, or for providers moving forward to make sure that they're keeping their clients engaged in services as much as possible?
So one of the things to do is to offer sessions where they could participate in not just individual counseling, but in group therapy. That way you have other individuals who are in a similar situation to you to share your experiences with and hear from them what their solutions might have been, something you didn't think about, or just to know that you're not alone and you're not the only one that's struggling through whatever situations are facing you. That often is a big stress reliever.
Absolutely. And from the perspective, from the judicial perspective, Judge Wren, you've had to change the way that you're serving clients entirely.
We have, Heather, but it's amazing that being on Zoom, the courthouse is not open yet for most of our courts, just really for some few essential divisions. So the rest of us really are holding court, as you can see. Welcome to my courtroom. On Zoom, but I have to tell you again, silver linings. People that may not have been able to get to court, they don't have to pay for parking. They don't have to, make that drive and face all that traffic. And it is just unbelievable. I mean, people are coming in and, we're able, somehow there's something about the technology from a judicial court vantage point that somehow levels the playing field. Here we are, I'm not up on a high bench, you don't have the court deputies, and it's really enabled me to, we're always humanizing the court process, obviously, in my division, but really to be able to welcome people and ask them, how are you feeling? It's so important, to just focus on people first. How are you feeling? To the lawyers, to the court staff, to the public, all of us, we're all in the same boat. And I think that it's really been a boost. I think that using technology in the court system is going to continue now, well after we get back in the courtroom. And I really think the public, to a large extent, has really enjoyed it. And it gives everybody a chance, to share what's happening in their lives. And we can, provide, resource information right there. And I think it's been actually very, very uplifting.
Absolutely. I really love the way that you put that silver lining on it. This levels the playing field by having access to technology. So a lot of our services that maybe weren't accessible before because of childcare and transportation and parking fees, because it's South Florida, that now maybe it's a bit more open. I think that's a really good way of looking at that as well.
It is. It's so true. People are holding their pets when they come on, and it's just, I don't know. I just really love the experience, and, you can still obviously adhere to the rule of law and still also humanize the court process. And certainly from a mental health and behavioral health vantage point, we need to pay attention to what people are experiencing and be able to offer them assistance and services, you know, so everybody has hope and they can get their problems resolved very quickly. I don't want to take time, but I know we don't have a lot, but it was such a unbelievable story a couple of weeks ago when one of the people in my, I also do a substance use prevention court, a regular court, a mental health court. I'm all over the map. And somebody came in and they were crying and said that they had lost their grandmother to COVID and they just didn't have the funds, you know, to have a funeral. And I was able to refer them to, you know, Broward 211, first call for help. And sure enough, that person was back on for a status hearing not soon after and said, thank you, Judge Wren. We got help and we were able, you know, to have a service for my grandmother. And so I really just want to make sure that everybody listening knows, you know, that resources matter. And if nothing else, and if you don't know who else to call, you know, for example, always remember 211 Broward, 211.
Absolutely. Thank you so much. And that was really nice that you were able to help with that, with the assistance for the funeral costs. And it just goes to show how we're coming together as a community.
Know how to refer, right. Know our resources.
Know our resources. Absolutely. Okay, I think we've got some good questions that are coming in. I would like to go ahead and combine a couple of them to just really to dig into the emergency orders in Broward County. We recently are moving into phase 2. And that will open up some opportunities to reduce isolation. But we're also from Miss Claudia. She asks, isolation is a huge problem. How can we as a community with our city officials and our county parks and recreations department start creating opportunities for group outdoor activities? Follow social distancing. Thank you for putting that in there, Claudia, to promote a healthy lifestyle and good mental health right now instead of waiting for the pandemic to be over. So is there any of our panelists that can answer what your recommendations would be for utilizing our parks and recreation space in the counties to be able to create opportunities to reduce isolation?
So if I could just pop in and say that our mental health and our well-being are going to be key to us being able to live through COVID-19. It's going to be around for a while. We have to have a new way of learning to cope with the anxiety and stress of everyday life, plus all of the additional things that COVID comes along with. So if it's not part of your regular routine now, getting out for a 20 or 30-minute walk by yourself, maybe listening to some music or just listening to the sounds of nature can be extremely calming. And there's lots of evidence to show that when we're calm, we're in a better place to make better decisions.
If I can add to that, I think really what people want to know as well is, can they get out? Can they gather in groups? And the answer is, you know, the science is we still don't know how dangerous this disease is, what the lasting effects are. I understand everybody saying that the death rate's 3% and I want to get out. I want to do this, that, and the other. I think as a general rule of thumb, if you're going to go out and you're going to be near other people, you still need to maintain a distance of 6 feet. You still need to wear a proper mask. There's a lot of people that are wearing masks that are not proper face coverings. Please respect other people who are wearing a mask if you're going to choose not to wear a mask. And also, it's very important, I just put into the chat so that if everybody wants, because there are numerous county orders, I loaded up where you can find the county orders. Know your county order, but also know your city order, because there may be different restrictions even in your community. A community pool may not be open, even though it's allowed to be open someplace else. And what I don't want is people having interactions or negative interactions with law enforcement. This is a tough time for everybody. So try to keep your social distance. I've seen some people using pool noodles to ensure that they're a safe distance from people. It's kind of a fun way if you're going to be outdoors, but keep that mask on, do it safely. And if there is a question, I also loaded my office's phone number so you can call us to help you interpret some of these confusing county orders.
Thank you. That is really helpful.
Good question from Claudia.
Very good.
Thank you so much, Claudia. And I know that there is some controversy around masks and some of the orders that are out there, and we won't dig into the specifics of that, but there are some questions that we're receiving about how safe should people feel going out in public when they're wearing a mask? And is that something that you can speak to?
Well, I kind of just addressed it, but I'm happy to say it again. You know, there are all kinds of masks that are on the market. Some that protect your breath from getting out, others that protect from other particular matter getting in. A lot of the cloth masks are not safe. And reusing and reusing and reusing the same mask and touching it over and over and over is also not safe. But again, there's a tremendous amount of uncertainty. My suggestion is that you buy an appropriate mask, and N95 is suggested, the ones with the filters, not necessarily because they claim that your breathing out can contaminate other people. The blue and white masks in particular, they say are very good. But some kind of nose, it's also important to cover your nose. And if you're going to be near other people, that they cover their nose, especially if you're going to a restaurant, or getting food and they're preparing your food. Ensure that their hands are covered and their entire face is covered. But I don't know that anybody has developed one mask that is better than any other at this point.
And if I could just add one little thing to the mask conversation, is we have still clients coming into the office for critical services and to receive injections and so forth. And one of the habits that I see is a lot of people pulling the mask down from their nose, so it's just covering their mouth. And of course, we know that it's airborne, and we know that it's we're going to contract it through our nose if anywhere. So if you're going to wear a mask, 100% coverage would be to be both over your nose and mouth.
Thank you very much. Okay. And yes, in Broward County and outdoor spaces or public spaces, wearing a mask is mandatory. Thank you, Margaret, for bringing that up. Okay, and I do have a question for Representative Gottlieb. You're the very popular one this evening. So a lot of organizations, and I see we have a lot of providers and organizations on the line that also pursue individual appropriations or state funding every year from legislators. I know we opened up talking about the budget. Can you give us a little bit of advice or insight for those organizations that tend to pursue individual funding requests for their programs, for their community programs from the state, and how we could navigate that this year under these circumstances?
So, as I said, we're definitely going to be squeezed or feel a squeeze, but I do think the money's there. I want to be upbeat about it. I do think the money's there. Hopefully at some point in time, our tourism will safely reopen, or we're finding other ways to generate money. I think what's important is to start early. I would start November 15th. So right after the elections, reach out to your local representative or whomever has run your appropriation before. Start talking to the people who are going to be in that silo. So for instance, I was almost everything judicial last session. I was in judicial approach. So if somebody's coming to me looking for some type of jail reform program, for instance, I would start there again. I hope to be in judicial again, but start with the people who are going to be in that area. Start with your local state rep and work those appropriations. I've passed several bills, and one thing that I learned early on was, if you want a bill to pass, worry about it. And I don't mean that in a negative way, but if you want to get your money, and it's a large pie, but if you want your small slice of that large pie, you've got to be aggressive without being obnoxious. Just get in there and get your money, because these programs are so important. We need to keep funding courtrooms like Judge Lerner-Wren's. Her courtroom is a tremendous benefit to anybody in Broward County.
I don't get any money, but I could.
Maybe not for the state, but the services and that we send people out.
Right, but it's our providers that need the money, and I think that there's no greater investment than making sure our community capacity, is expanded.
Absolutely. So, and you know, those programs, they need to be funded. And we need to tell people, not just I want the money, but why, where it's going to go, how it's going to be used, so that the legislature will hopefully fund it and appropriate it.
Yep.
Gotta make your case.
Urgent.
It's going to be a lot of advocacy for this, for coming up this year, for sure, to make our case for our programs.
And I think, Heather, it's important that those people who may not be on the inside loop understand when Representative Gottlieb is talking about appropriations, that the state always attaches measurable outcomes to make sure that the taxpayers' dollars are being well used, and if they're being asked to be used again, that they were moving the needle in whatever area they had promised to do so.
Comment.
Thank you. I've had a couple of questions come in about resources for our parents dealing with childcare. I was hoping maybe we could touch on that for a few minutes and really have more of a discussion around, we have parents who have their kids in e-learning. The pandemic has greatly impacted the ability of our childcare providers to continue to keep their doors open. I know we've been seeing that from not only our own employees and our own stakeholders in the community. So if we could discuss what financial resources are there for parents, if there are any. I know we have some options at United Way that we could talk about with our learning pods, but to open it up to the panelists. And what advice do we have for parents who are working but also having to supervise their children during e-learning? Open question for anybody.
So I think that would probably be a great question for the folks at 211, so that you could zone in on what area of the county that you live in, and they could connect you with a child care provider that is closest to you and meets your needs. And I would think that the other excellent opportunity would be what Representative Gottlieb has offered earlier, which is to call his office. I know he would be more than happy to keep his constituents and anyone else up to date on new opportunities or new programs, or as things are reopening, to keep them informed. I don't want to speak on your behalf, but I know your office staff is on top of things.
Yes, we are. We try to be. There's also wonderful programs that I think everybody needs to reach out to in the community, depending on the needs of the child. There's programs like JAFCO, ARC. Those are wonderful programs that have been in operation for a very long time. Those are specifically geared towards children with special needs. But there are other programs now and perhaps babysitting services that we can help people find if that's what we're talking about. None that I know off the top of my head that I can recommend, but I think that Gary's correct. If we call 211 or you call my office, again, I put the number there. Linda will help you based on where you're living in Broward County, or even if you're outside Broward County, to find a program that's close to you that'll help with your needs.
And can I just make a comment? This really isn't on a system level. It's really on the individual level, particularly having to do with the moms and the parents. And, you know, it was always stressful, you know, juggling parenting and work and everything else, you know, that we have to do. But now the stress levels of the research that I'm reading, and what I'm also just asking, you know, all the young moms about, and how's it going? It is increasingly stressful. And it's really important for our moms and dads out there, you know, to take care of you know, to watch their own self-care and make sure, you know, that they're getting their needs met in terms of rest, and you know, if they need to reach out for help, you know, that's really, really important to do. That just because you're a parent doesn't mean it's a sign of weakness either, you know, to reach out for help when the stress is really getting to you, because it's really, I think, under these set of circumstances, very, very challenging. And I just think everybody really needs to make sure that they're taking care of their own mental health as well as focusing on their children.
And if I could share just a small anecdote, I sat in last week via Zoom, of course, in our parenting program, and there was a lot of discussion amongst the parents sharing frustrations, and they called themselves their child's IT manager. So, you know, Mom, the sound's gone. Dad, the video's off. I can't hear the teacher. She can't hear me. And so they found some solutions amongst themselves about what they each do in their household. And then there was just that support again of being able to know you're not the only household going through this. You're not the only parent struggling with this issue.
Absolutely.
I'm sorry, Heather. I also want to add that, you know, part of the money crunch, it's not just watching children, but there's significant food expenses. And there's still a lot of Feeding South Florida events going on. So if part of the problem that you're having, and I know a lot of people don't necessarily want to admit this, but there are Feeding South Florida events where you can get in line. And I've handed out the food numerous times. It's really fantastic food, great meals. If you don't need that and you have the ability to, you can donate to Feeding South Florida. I forget what it was, but I think it's $1 provides 7 meals or something like that. It's really a phenomenal organization. And as well, if you're homebound, because I know there's a lot of people that are potentially homebound or due to specific health problems may not want to go out to get the food, they can make arrangements to get it delivered to you. So if that's part of the problem as well in terms of the childcare issues, Feeding South Florida is there to help.
Absolutely. I know you've been really engaged with them. I'm glad that you brought that up, that their services are available.
They've just done a wonderful job. And you know, when you see the amount of food that they're giving out and the quality that it is, it really, I know a lot of people don't want to go because they think they're not getting quality food, but it's really been fantastic.
And that leads me to bring up another point, if I could quickly, Heather, is that there are a lot of people in our county who have never had to access safety net services. And navigating that for the first time can be overwhelming. Where do you even start looking for help with food or looking for help with your rent or other basic necessities for those that have, you know, never had to do so before and now find themselves in a situation where they need to? I think everyone on this panel would agree that Broward County has amazing resources, amazing programs. Everyone that I'm aware of in that safety net provider group is up and running and is anxious to help. And 211 is the connector.
Yes, 1,000%. And I think for 211 as well, you can access for parents resources if you're working from home and you're not able to supervise or be the IT manager for your child, or you're finding that dynamic to be really complicated. In partnership with Children's Services Council, United Way is funding a series of learning pods to be able to connect students to safe learning environments that have oversight with IT to make sure that you have the support and you can access those services through 211 to see what might be local to you and to your child as well. We do understand that this is a really difficult time for parents that have their kids in virtual learning. I know we keep saying 211, but that is the great connector, as Garry just said, to all of our resources within the community, very specific to your zip code to ensure that you're getting what is needed for you and your family.
I want to add one more quick thing, Heather, before we move on. Somebody put in the Q&A that Boys Town is offering virtual parenting classes. And so I think, you know, we all look to people like my office or Garry or the judge, but you can also reach out to your friends because somebody just had a wonderful suggestion. So, you know, we all have these, our little COVID pods of friends and people that we're talking to. Don't be afraid to reach out to somebody within your sphere of influence and ask them for help as well. And Boys Town was a great suggestion.
It is. And Miss Claudia, thank you for another great comment. Could you please provide the contact information in the Q&A for the Boys Town program, which is also sponsored by Children's Services Council? All right, we do have one. This is a really good question from Miss Sandra, that we have parents who have been particularly concerned with the mental health of their teenagers and their young adults at home due to COVID-19. What advice do you have for them, for parents of teenagers who are really struggling with this time?
Well,
You
I'm
know,
going to refer to the two experts who have teenagers, or have had teenagers, I should say, the judge and Representative Gottlieb.
yeah, I just want to emphasize, you know, that it's really important to trust as a parent, to trust your intuition. That's number one. And there's no reason, and this is not, you know, there's no reason to wait, you know, to validate your concerns with regards to, you know, your teens or preteens. We know that we are in a very serious suicide epidemic. I do sit on the executive committee of the National Action Alliance for Suicide Prevention. And, you know, if you are concerned, then you really do need to reach out. You could, you know, it's whether you call 211, whether you contact one of our local mental health centers like Henderson Behavioral Health Center, or any of the other mental health providers, or even if you have access to a private provider, but most definitely connect for help. It's no different than if you know, think that your child is coming down, you know, with an ear infection or something that you need to go to a pediatrician. You know, mental health, physical health, it's all health, and it needs to be taken seriously.
I agree, and I'll tell you, there's so much uncertainty that, and it's not, no family is immune from it. You know, my family, you know, we try to be as educated as we can about the emergency orders. I have a 17-year-old and a 16-year-old, and the four of us sat down for dinner the other night, and it was a virtual food fight, if you will, over masks, going to school, wanting to get together with friends. It's been a long summer, cooped up in the house. And there's really, it's very frustrating because there's no right or wrong answers because there's so much uncertainty. And it was a really interesting conversation too, because it was a unique opportunity for my wife and I to see how much our children have intellectually grown. And it's, what I would say is people also, when you answer those questions and you're looking at your kids, we tend very often to overlook things because of our routine. So step back and take a look at your family as if you were an outsider, because very often we miss a child when they're talking and we miss the fact that they're really troubled and we're not hearing what they're saying. And it's very important because our routines are no longer routine and we're in a new routine. And I hope that makes sense. So you might be missing some of those red flags. And it's just, you know, very difficult. So listen to what your children have to say, step back and really hear them, because it's a very difficult time. They're living their lives socially online, and that's, it's really hard. And it was a really hard conversation that we had about whether they should or shouldn't get back to school. And it's, you know, so my suggestion is, you know, really just listen to them. And also somebody put in there about yoga, which I think is fantastic. These de-escalation techniques that people should be doing. I run every day. I come home, I run a couple miles every day. It really centers me. Yoga is wonderful. You can find all kinds of videos online, breathing techniques, just so many different things that I'm sure both the judge and Garry can really talk about that help us center, and that we can do with our children as family, fun exercise. My son and I have been doing push-ups, just fun things like that to really get your mind off of what perhaps is bothering you.
So the only thing that I would have to add to that would be to be sure that you're asking questions, such as, how are you feeling? And don't accept, you know, a one-word answer. Probe a little bit deeper, show genuine interest. What are you thinking about? Are you scared? Those are the kinds of open-ended questions that can engage children to let you in a little bit to maybe things that you weren't aware of, or red flags that, because we're all so stressed right now, you may have missed.
And there are other ways as well that they can engage with their friends. I know Linda and I were talking earlier today, my aide, and she said, I didn't even know this, but there's apps where you can watch a movie, the same movie together at the same time, but yet be in different locations. And that's just something that's great to be able to share. So if you can't do movie night with your friends, you can still do movie night with your friends virtually. And I think we all need to explore other ways to engage in safe manners that are physically safe and mentally sound.
Yeah.
Absolutely. I think one of the best things that you all have really touched on is that there is so much uncertainty. And for us as human beings in general, just from our own self-care practices and, mental health experiences, know that when there is uncertainty for us as individuals, what happens next, what's happening in our community, what's happening public health wise, it creates so much fear and anxiety and distress. And so we're feeling that on so many different levels right now. I can only imagine how our young folks are dealing with that. And I think one of the things that we can talk to them about, and something that the commission has been really great about highlighting, is it's okay to not be okay. Like, this is a very not okay time, and we're having these conversations and engaging with each other and figuring out what the answers are so we can maintain our sense of stability and maintain our sense of okay. But having moments where you don't feel great and you have to reach out to talk to someone about it, that's totally fine. And I love that campaign. It's okay to not be okay. It's a very uncertain time. I think that we have also had some questions coming up about the smaller resources that are available out there. Again, I just want to suggest that we talk to or call 211 for some of the smaller financial resources that may be available to you and to your family. Honestly, you give them your zip code, put it in, and it'll drill down to see exactly what is available for you, for your family, and their counselors and their operators on the phone are highly trained and able to assist you, and they've been doing a really great job. We love 211. We wanted to also, real quick, this is one in general for our schools. We've had a couple questions come in about schools. I know that we wanted to have this topic come up in the future because we had just been discussing as a group that our schools may be reopening. We don't have anybody from Broward County Public Schools on our panel, so I'm going to preface that. But as a general topic of conversation, so we can touch on this since questions are coming up, what would your suggestions be for the schools as consumers, as parents, and as leaders in our community about keeping our schools safe as we transition into our phase to reopen?
I guess that's maybe more directed towards me as the state rep here, but number one, I saw somebody asked in the chat, what can we do to guarantee? We cannot guarantee that anybody's going to be safe. So that's first and foremost. So if you have any kind of significant health problem, you should let that be known to the school or possibly not attend. Broward County is contemplating opening schools by October 5th to 30% of the students, whether it's live or virtual at the school. Again, my suggestion is wear a mask, bring some type of hand sanitizer with you, if not wearing gloves. And I know that sounds onerous and that's not fun, but whether you're a teacher or a student or a parent going to pick somebody up at the school, we still need to, even though we're reintegrating back into society, we still need to maintain proper social distancing to keep this disease flattened, to keep the curve flattened. Certainly masks. I don't care if you're just walking from class to class, keep it on. It needs to be on all day except when you're eating. But there's really no safe solution, and that's why we're still struggling it. And even the schools that are open, your privates and your charters, are only open at 25 to maybe 50% at this point in time. So Broward County Schools is struggling with it. There is no, from my perspective, real true safe way to open. And that's why we're seeing that the court system is still operating virtually, because we can't get that many people into the courthouse and do it in a safe manner. So just be smart about, what you're doing. And I would say, again, hand sanitizers and masks.
Thank you very much. We are getting close to the end, so I'm going to try and find a question that can wrap us up for some lingering thoughts on, as a community, as individuals, how, I'm going to combine a couple of things here. We're experiencing a lot of anxiety. As individuals, we're experiencing a lot of anxiety. As a community, we're experiencing a lot of anxiety. We have social unrest. We have a lot of racial tension because of social justice within our community and our larger society. We have public health concerns. How do we, as a community and as individuals, build resilience in ourselves? How do we build resilience in our families? Any thoughts from you?
So the one thing that I would share is that there are a lot of people who are holding their breath, waiting for this to be over. And I don't think that's going to be anytime soon, that we're going to be dealing with this for quite some time. And so the first thing to do is to maybe focus on what you can do now and how your life can be more fulfilling now under all of these new conditions and under all of these new stresses and all of these new rules, and figure out how you can fit in, knowing that this is going to be our future for the foreseeable future, and that we have to adjust to make sure that we protect ourselves and others, and that focusing on the moment, being present today, is where you can effectuate change right now when things are so uncertain. Worrying about tomorrow and next week, maybe not so effective, but focus on today and the loved ones around you and things that you can do to support each other.
I think that's right. I also think, that while these times are so uncertain, there are also times for us to reflect, on ourselves, time to cultivate, our own, vision, for ourselves and our family. And I think that from a community vantage point, a couple of things that I was thinking, some of these questions that Representative Gottlieb so bravely tried to, take on, a lot of these questions, we just really have to, I think, be willing to acknowledge we just don't know all the answers yet. Mm-hmm. But I do think one thing about our community, certainly about my experience working collaboratively across the entire county, across systems, across lifespans, across population health, that we do have a very, very tight-knit collaborative and various coalitions that we've learned how to bridge and align. And I'm really hoping that we can take these coalitions, that we can take this very, very early dialogue that we've had through this webinar, and we could actually, build that out, maybe to, bring in subject matter experts from very diverse interdisciplinary areas, get some of these questions really answered, maybe do a weekly public affairs show strictly devoted, to this uncertainty and building resilience in the COVID-19 pandemic in our community. And I think when we do that, new coalitions are going to form and new strategies are going to emerge, and we're going to have a new vision. So I see this today as just a really, really great opportunity, to work forward and create a new vision to build resilience and inspire hope for everybody and get the answers based on the evidence that we know and we have from all the various experts that we really need, because these are complicated problems. Mm-hmm.
I agree with all the above, obviously, and I just want to add one more thing. We're all in this together. Everybody is going through this all at the same time, and despite all the political infighting that we're seeing, we're really all in this together. And the solution is for all of us to work with one another, to respect the other people, whether they're in your community, at work, if you're going to work, at the grocery store, so on and so forth. And, as I said before, it's such a period of uncertainty and high anxiety, if you will, that we all need to breathe.
And be kind, and really be kind to one another.
100%.
And, and really be kind and compassionate to one another, because I've noticed if I'm in Publix or I'm here or I'm there, simple acts of kindness could make your day. I mean, it could totally shift you from,
Yes.
really feeling despair to feeling, oh my gosh, we're going to get through this. It's going to be okay.
And
I really think that as a community, we've known this in the past through hurricanes. We've gone through so much together. We're going to make it through this as well together.
100%. And like you said, being kind to somebody makes your day. Also, at that same point in time, if you get miffed at somebody because they walked the wrong way down the aisle at Publix, that could stay with you throughout the rest of the day and put you into a negative area. So it's just a matter of, we all need to decompress. I know we did not get to everybody's answer. I know that there's a lot of questions that are still unanswered. I don't know if anybody else can see the chat. I did put my information in there from my office. If you all want my cell, I'm happy to give out my cell. It's 954-682-0999. Okay. I can be reached if you're having a problem, especially if it's an emergency issue and you need to talk to somebody. That's what my office is there for. And I know I speak for the rest of the panelists. We're all here really just to help you. We want to give you as much information as we can in a positive way, because we will get through this together.
And just a quick one, Heather, to piggyback on the be nice and be kind to each other. I was the recipient this morning of the person in front of me at the Dunkin' Donuts drive-through paying for my order. And so when I got to the window, they're like, oh, it's free. So I said, well, I'll get the one behind me and keep it going. And that was just a little thing, but it completely changed my my outlook, in those few moments. So it was something nice somebody did.
We can do, right?
Absolutely. And I think that what you guys all said is so important. It is such a crazy pants time right now. And I think that by showing each other a little bit of kindness, there is so much infighting. Y'all know, if you're getting on social media, there's a lot of infighting and there's a lot of negativity. And I think one of the best things that we can do as a community and as individuals is to take a step back, take a deep breath, and to show our humanity and our kindness first. Everybody is dealing with a lot right now. I want to thank you all for your participation and your words of wisdom and your insight. As Representative Gottlieb said, we didn't get a chance to get to all the questions. Some of them were really individualized, and I wanted to make sure that we could answer them to you specifically. So all of the information that's synthesized on this chat, we have questions that we didn't get to. We're not ignoring you. We're going to make sure that we answer them and send them out in an email format so that you have them. Just didn't want to be telling you that we didn't have the answer for you. So we'll make sure that all of your questions from this chat do get answered. Also, there were some suggestions for providers, which are fantastic. Our consumer-based providers, like our South Florida Wellness Network. So we're making sure that we're having peer-to-peer services. Any suggestions that were in here tonight, Paul Jakewith from Mental Health Association was on. He gave some contact information that I, in my technological ignorance, closed out, but it'll show back on the chat. We're going to make sure that you have access to all of those resources that have been mentioned here this evening, so that you don't feel like you're missing out on anything. Really appreciate everyone's time. At this point, Angela is going to take it back over to talk about some of the resources that we mentioned here this evening to make sure that you have the information that you need. Again, I want to thank you, Judge Wren, Representative Gottlieb, Garry. Your time is so important. You guys are leaders in our community and you get pulled in a million different directions. That you took the time to sit and be with us this evening, that you sent out this invitation to your networks to make sure people would have access. We cannot thank you enough. You are amazing advocates and great representatives for Broward County. We're lucky to have you.
And we're lucky to have you, Heather.
Thank you.
Thanks for putting it on.
Thank you. Thank you so much, Heather, and thank you to the panelists for all the information, insights, data, and resources to help all of us navigate through these challenging times and to move forward together as a community towards that new vision that Judge Lerner-Wren mentioned. So we want to say also thank you to all of the attendees for joining us today. We want to invite all of you to keep the conversation going, to keep participating in the events, and to join our action teams. For more information about this, we are going to be sending out that email, but also you can go to our website, www.drugfreebroward.org, or the United Way of Broward. And also remember, if you need help, it's okay to ask for help. Ask questions, there is help out there. So please call 211, which is the first call for help here in the county. They are available 24/7, and they also speak different languages. So thank you again, and have a wonderful night.
Night, everybody. Thank you.
And everyone, thank you.